Thank you for taking the time to log on to the learning module Evaluation Strategies on Student Written Communication. This information was collected from our Billings and Halstead book, Teaching and Nursing, specifically chapter number 27. After completing this module, the student will have reviewed the presentation, completed a 10-point quiz, responded to the case study, which is located on Blackboard, as well as completing an evaluation survey of the module. This presentation was prepared by Nicole Daly, Stacy Orbell, and Shannon Robertson. Communication is the key to understanding, be it verbal, written, nonverbal. They all play important roles in helping us communicate with each other. In the written format, it allows for faculty to evaluate clinical performance and also assess the students' abilities to translate what they have learned. It provides evaluation of the student's ability, as well as how effectively they are able to communicate with other care providers. From a student perspective, it allows an opportunity to clarify and organize thoughts. Reinforcement of new knowledge and expanding thinking on a topic. As educators, they are able to analyze the quality of the content. And as students, the ability to communicate information. Written communication gives insight into the student's perspective and into the difficult why questions of a student's behavior. From a grading standpoint, it promotes consistency and efficiency. This example provided is a rubric, which we are all familiar with. It gives us an outline or a guide as to how we are going to be graded and what information is needed to be included. Written communication supports clinical observations. There are 6 different written types of communication. The first is documentation and patient progress notes. By definition, these are the notes made by a healthcare professional that describe the patient's condition and the treatment which has already been given or is planned. In this example, there is an electronic medical record where assessment findings can be charted. The evaluator benefits to this method allows for assessment of the student's process and their ability to record relevant data. It allows analysis to determine if the students are using the correct terminology and documentation practices. And it also allows insight to determine if students are using critical thinking processes. The second type is concept maps. This is a diagram of a patient needs as well as nursing responses. Nursing responses included in the relationships among the concepts. So for example, congestive heart failure would be the main idea, the core concept. In the orange color boxes, we would have treatments, symptoms, for example. And then in the green squares off of the orange boxes, you would have more detailed, like what the symptoms were, what the treatment options were. The benefits to concept mapping include the ability to assess an understanding of concepts and relationships to determine if students have either a misconception or a full understanding of the topic. It provides a quick review prior to patient care in regards to learner needs. This can easily be reviewed in a pre-conference setting. And it also allows students to have a worksheet to assist with their documentation. The third type is nursing care plans. By definition, it is a plan based on a nursing assessment and diagnosis, which is carried out by the nurse. There are 5 essential components, including assessment, diagnosis, planning, implementation, and evaluation. I would like to repeat those 5 essential components, as you will most likely see them again in this learning module. The 5 essential components for nursing care plans include assessment, diagnosis, planning, implementation, and evaluation. The evaluator benefits to this method include allowing evaluations of a student's ability to identify and prioritize care needs. It allows an understanding and interpretation of an individual's patient health problems and demonstrates the student's clinical thinking processes. The fourth type is process recordings. By definition, it is a system used for teaching nursing students to understand and analyze verbal and nonverbal interaction. This can be done in the form of role-playing, where one is the nurse and one is the patient, and give specific scenarios to see how the student will interact with the patient. I would now like to play a video for you to watch, which gives examples of both good communication and not so good communication.
Hey Marvick, how are things going today?
Fine.
Noticed you haven't touched any of your food. Is everything going okay?
There's nothing wrong. Just leave it.
Is there something you want to talk about?
Okay. It's the chemotherapy, okay?
What about it?
It just hurts everything. I have sores all over my mouth. I can't eat anything that you guys give me.
It'd be really frustrating if you can't eat any food, especially if we're trying to for the health professionals who are giving it to you. Have you tried anything soft?
Nothing. I'm just not in the mood to eat at all. I'm cooped up in here all day, getting chemotherapy on. I'm just not hungry. It hurts everything.
Okay, well, Marvick, you've got to keep your strength up, right? How about if I talk to the dietitian and see if they can come in and maybe get you something softer to eat? And we can talk about maybe getting you out a little bit more too. How does that sound?
Alright, fine. Alright, let's try that then.
Okay, so I'm gonna go talk to the dietitian a little bit later on today. We'll get you something new to eat. We'll try a couple different things, and then we'll get you up walking around. So hopefully that'll lift your spirits. Okay?
Okay.
All right. Talk to you soon, Marvick.
Sup? Hey man, you didn't eat anything.
No.
Alright, well, you need to have something in your stomach though, because I pour all your meds into the cups into the drawer here. So I guess I'm just gonna have to throw that out. Are you gonna eat that?
No.
Any of these? No? Alright then. Let me just clean that up for you. And you have yourself a fantastic day.
Marvin? Hey, what's going on?
My meds?
What about your meds?
They're so expensive. Lost my job. Can't get any more meds.
So, you lost a job and you can't afford your meds anymore?
No. And the hospital and the nurses and I hate purple.
Okay, well, let's talk about the meds part first, okay? Let's see if we can solve that problem, okay? Okay? Alright, so...
Okay.
So, when did you lose your job?
A week ago.
Okay, and you've been having problems finding the money then for your meds?
Yeah.
Okay, well, that might be something we can help you with. One of my coworkers, her name's Sally. She's a social worker. She knows all different types of benefits and different types of grants that maybe you can get to help lessen the cost of your meds. Would it be okay if I got her to come in and talk to you? Yeah? Okay. I'm just on my way somewhere, so I've got to go do some things. I'll talk to Sally on my way and I'll see if she can come in, alright? But I'll be back in about an hour, okay? And just check on and see how you're doing. Let's see if we can just deal with that problem and then maybe other things will solve themselves, okay? Alright.
Sup? How's it going? Hey Jeff, I saw you talking to your patient over there. Would you mind if I give you some feedback?
Yeah, that'd be great.
I like the way how you always have time for your patients, and
Thanks.
that's a really good thing.
Thanks,
right?
I tried.
Yeah, no, that's really great. The thing maybe you could work on is that he does seem to be having a little pressing issues. So the fact that you said you might come back in an hour is a bit too much, because the patient might think that you might not have enough time for him, and that might be too long.
That's good. He was pretty upset. Maybe I should have stayed with him for a couple more minutes, or maybe even said that I would deal with it right away, or something like that. Yeah.
Yeah, no, but overall, you did. I really like the fact that how you did that was how you had time to even talk to him, because it's just an awesome job you're doing.
Wow. Okay. Well, thanks. I appreciate feedback. I'll make sure that I use that.
All right, high five! Hey, all right. Hey, I gotta go. No, I gotta go. I gotta go. I gotta go. I gotta go. Okay, bye. Stop.
Hey, Margaret. I just noticed that one of your patients was crying and.
Oh my god, Jeff is giving feedback again. This is so boring. I wonder what mom's cooking for dinner tonight. Oh my god, I hope it's chicken. Oh god. Chicken. Oh, I hope I'm home in time before this conversation ends. It's gonna take like a year.
Okay.
Huh?
The evaluator benefits to this method include the ability to evaluate the interpersonal skills of students in a clinical setting, and it also allows students the ability to self-evaluate communication skills used with identification of their own strengths and weaknesses. The fifth type of written communication includes pencil and paper or electronic testing. We are all familiar with the infamous Scantron tests that are pictured below. By definition, this is the ability to demonstrate knowledge by completing an exam that is either multiple choice, true, false, matching, short answer, or essay style questions. The evaluator benefits to this method gives a measurable assessment of student problem solving and decision making capacity in clinical practice. The final type is web-based strategies. This is the use of communication in an electronic form that a group or individual is able to log onto the internet and connect to each other. The prime examples of this type include Blackboard, which we are all too familiar with, as well as email communication. Evaluator benefits include the ability to conduct web-based conferences and case discussions, the ability to monitor clinical work and discussions, and the one that different universities and colleges have honed on is this form is beneficial for students who are in a variety of geographic location and coursework in a diverse community settings. In conclusion, we will leave you with a few thoughts in regards to evaluation of students from a written communication standpoint. Please always make sure the evaluation methods are appropriate. And as a faculty member, it is imperative to make sure that learning occurs and your testing confirms the learning transfer. John Rohn stated, "Take advantage of every opportunity to practice your communication skills so that when important occasions arise, you will have the gift, the style, the sharpness, the clarity, and the emotions to affect other people." We want to thank you for your participation in this module. Again, I would like to remind you to refer to the information sheet that will give you the link for SurveyMonkey to complete the 10-point quiz. Please refer to the discussion board case study and questions on Blackboard. And finally, please complete the SurveyMonkey evaluation tool that we have provided. If you refer to your rubric, it gives 2 points for completing that final evaluation. It is imperative that us as a group complete that. It's a very easy part of the assignments and a very easy 2 points. The catch to that is that all students in the course must respond. So I'm sure that will be no problem. If you have any questions, we will have a place on Blackboard that you can post questions, because if you have a question, there's chances are somebody else in the class might as well. So please feel free to use that space to post any questions you might have for Nicole, Stacy, and I. Again, we thank you so much for your participation and hope that this has been a positive experience.